Beautiful girl, beautiful man again. No, there is no beautiful man, handsome man, and everyone who is watching today. Welcome to this channel. Benjamin the Wise Guy is the channel. You see, Benjamin the Wise Guy is the channel, and we want to discuss about something that is. Someone asked me about it, which is very funny. Someone asked me about this topic called. Molar pregnancy. What is molar pregnancy? Someone might ask you, what is molar pregnancy? I was talking about something, and then I said, imagine going to a lady going to take a pregnancy test, and then it turns out to be positive. And when this turns out to be positive, imagine it turns out to be positive, and you don't have a baby. Molar pregnancies. That is the topic of the day, and then it raised issues like people were discussing, hey, what type of pregnancy is that? It turns positive and you are not having a pregnancy, man. How can someone turn positive and you don't have a pregnancy? So that is the topic that we are going to discuss today. How can something turn positive and you don't have a pregnancy? Just imagine. That is what we are going to discuss. So I'm just turning in 1 minute after. If you are coming in right now and you are a new person, you know have to do what? Click and subscribe to the channel. You have to subscribe to the channel. Jamaican Uncle is here, and we thank Jamaican Uncle for your help, for your support and everything. Welcome to the channel, everyone. If it's your first time here, don't just brush away. Don't just brush away. Support the channel by subscribing to the channel, hit the like button, and if you have any question that you want to ask, please ask. Come to the chat, tell us, I'm watching from this continent, this country, and this is my question. What Here we discuss about medical issues, mental health issues, and we talk about specific things that help people to live well. Now, you are new to the channel, don't just go. Stay around, listen to what we discuss, like, double tap your screen, and leave us with your subscription. Come back again, see the videos that we have, and support the channel by giving your subscription, and come to the chat, tell us where you are watching from. So today we are dealing with a very funny topic. A woman goes to a health facility, and then you take a pregnancy test. And it turns out to be positive. But in real sense, whatever that you have is not a baby. Whatever that you are having inside you is not a baby. Just imagine. Hey, what do you do now? Because your pregnancy test is positive, and whatever that you are having is not a baby. So that's what is called molar pregnancy. I can see people are joining. Join, my friends. Join. Come and say hi. Tell me where you are watching from. Which part of the world? Rich Sue. Rich Sue, hi. Rich Sue is here. Now, Rich Sue, today we are discussing present dog all years. Great topic. Yes, if you have ever heard about molar pregnancy, that is what is it. Straight about it is about you going to a hospital, and then you are taking a pregnancy test. When you are taking a pregnancy test, like that. Thank you so much, Rich. And then when you're taking a pregnancy test, what happens? It turns out to be positive, but you don't have a baby. That's what is called hydatid form mole. It is called molar pregnancy. So it can be called hydatid form mole. The blessings to you, Benjamin. I'm trying to catch up upon some work before the rain starts. Good. Thank you, Uncle. Please catch up on the work. Now, it is called molar pregnancy, but at times it is called hydatid mole. Hydatid, H-Y-D. Let me post it. Hydatid form mole. It is hydatid form mole. And I will put pregnancy. Do you believe you can go check your pregnancy test? It turns to be positive, but you don't have a baby. Let me put it here. Let me put it here. I'm putting a poll. I'm doing a poll. Do you believe you can have a positive pregnancy test, but you don't have a baby in your womb? I'm putting it as a poll. I see how people will react. Pregnancy. Imagine you're having a positive pregnancy test, but no baby. In the womb. You have it is called a womb, like that. Yes, my friends. So welcome everyone who is watching, and please, if you are watching, you tell us where you are watching from. If you are watching from Kenya, Zambia, Zaire, Uganda, Tanzania, all those places that you understand, you tell us from the chat where you are watching from. So molar pregnancy is a typical gestational trophoblastic disease. When I'm talking about, someone will ask me, gestational is a pregnancy when a woman is pregnant, but someone will ask me, when you are saying gestational trophoblastic, some terms are complicated. These are cells. Anything that I talk about cells is called layers of cells. Trophoblast refers to trophoblasts, specialized outer layer cells in early embryo, the cells themselves. So molar pregnancy, just as I've said, is a form of pregnancy that is called hydatid form mole. Mole is a gestational trophoblastic disease. Gestational trophoblastic. Don't say doc is talking about very hard. Don't say doc is talking about very hard names. No, trophoblasts are layers of cells. Trophoblastic, layers of cells. You see, disease, gestational, pregnancy, layers of cells, but it's a disease. The embryo creates layers of cells, but it's a disease in which it is abnormally fertilized. Abnormal fertilized. You create, when you're making love with a man, creating a baby is a good thing, and then the sperm they fuse with the ovum. They form cells, but it becomes a disease. Abnormal fertilized. It is abnormally fertilized. Result in excessive proliferation of trophoblastic tissues and swollen field chorionic villi. The pregnancy is non-viable and may progress to persistent trophoblastic disease or rare choriocarcinoma. Hey, when I'm reading about that, I can just imagine what happens. The fertilized egg comes up with another thing that is not a baby, and it can be choriocarcinoma. You see, so when you hear that you have molar pregnancy, women, when you hear that you have molar pregnancy, I want you to know that the fertilized egg did not turn up to start creating a baby. You see, there is a poll that is going on there. Please, if you are coming in and this is your first time, do you believe that you can have a positive Do you believe you can have a positive pregnancy test, but what you are carrying is not a baby? You see, how can it come? And that's why we are learning. This is for women. I'll go slowly because this topic is very confusing. It may be very confusing. So we have said it is called hydatid form mole. Is an abnormal pregnancy. Abnormal pregnancy. The cells fused but they are not coming out with a baby. Abnormal growth of the placenta, trophoblast. Anything I'm talking about trophoblast, just know they are abnormal cells. The placenta is growing in the abnormal cells. Swollen chorionic villus. The villus, you know, the placenta has the how can I do it? Let me explain while I'm drawing. So if you are coming now, I have a pole that is going on there. A pole that is going on there. Do you believe you can have positive pregnancy test and what you have is not a baby? Now this is the I'm drawing a placenta. I'm trying to draw a placenta like this. Sometimes drawing is a good thing. So look at this. This is the placenta and it is attached to the uterus. So these things that I've drawn here, these are the villas. So instead of them attaching in here like that, they are swollen. They become like round things like this. Like this. Let me draw them. They become like round. They become like, instead of the placenta touching like this, you see things like these ones. You see things like those ones. Excessive production of human chorionic gonadotrophic beta HCG, absence of abnormal development of fetus. Now, this pregnancy, one, the placenta is abnormal. It is like other tissues, like muscles that are attached to each. And then the things that attach to the uterus, the villus, this one, they are round, you see. And then there is a hormone that when you go to take your pregnancy test, you know what you take is Michael N. Hi Michael N. Today I have a very funny topic. Even so, I know some people are confused. How can your pregnancy test be positive and you are not carrying a baby? You know, how can it happen? It can happen because this is a disease. And what I was explaining is, you know, when a woman goes to the hospital to take for pregnancy test. Blessings, Michael N. Welcome to the platform, Michael N. I hope you are doing good. Today you are listening to Dr. Benjamin with a strange topic, a topic that women are confused about. If you have ever met someone out there saying, I went to a hospital, I took a pregnancy test, it was positive, but the doctor says I'm not pregnant. I have something that is growing that is not a baby. Now listen to me and listen very carefully. I'm watching in the bush. No worries, I like bushes, I like green. The bush is everything. Trees are life, you know. So I was explaining what we do. There is something called human chorionic gonadotrophy. Chorionic, the placenta has chorions. So that is what we test, the hormone, beta HCG. So when you do a dipstick, it turns positive. We know, this one is starting to create a placenta. Oh, this person is pregnant. So in this disease, that hormone is excess. Why? Because the chorions, instead of being like this, they are fat. So they are producing a lot of HCG, you know. Someone may wonder, what is the doc saying? What is the doc saying? I'm saying, when you make love to your woman, you may find this problem that the cells that create a baby are abnormal, and they are not producing the placenta, and they are not producing the baby. It's a disease. So because the placenta has abnormal growth, it produces human gonadotropic hormone. When you go and test it, it's positive, but inside you it is not a baby. It is classified, and the characteristics are this. If it is complete and there is nothing in your womb, complete and there is nothing. Guys, if you are watching and you are new to the platform, tell us where you are watching from, and go and check on the poll that is going on. Check and say yes or no. Say yes if you believe you can be having a positive pregnancy test and you don't have a baby. Say yes. If you don't believe, say no. We see who is who and where is where. Now, you can have it completely where you don't have anything in your womb. You are pregnant positive. You are pregnant positive, but you don't have anything in your womb. So this one is no fetus or no amniotic sac. Amniotic sac is that sac that have amniotic fluid that the baby is in. You see? So you are pregnant. You are pregnant by results. You are pregnant watching from Geneva, Lakeside, Switzerland. Yes, I have a friend who is in Switzerland, The Hague, and I've not seen her for so long. Very close. Thank you so much for reminding me of her. Now, you have no fetus, you have no amniotic sac, but you are positive on pregnancy. And then all the chorionic villi are swollen like this. Instead of attaching to the placenta, attaching like this, they are swollen like this. Diffuse trophoblastic proliferation. That is what we call them. And then the hormone that we test for pregnancy, if we check it, it is very high. Why? Because the chorionic villi are swollen. It is very high. Yes? Greater risk of persistent GTD and choriocarcinoma. These people are at risk of getting cancer. Mostly cancer in the uterus, because we call it choriocarcinoma because the villi are in the uterus and we call them choriones. So they are at greater risk of getting cancer. And yesterday we were talking about XX and XY, where Y is transmission of the baby boy and XX is transmission of the baby girl. Usually 46 chromosomes, that is XX, most common, or 46 XY, results from fertilization of empty ovum by one sperm that duplicates its chromosome. So one sperm fertilizes an empty ovum. So this problem mostly is because of the woman. You see, or two sperms can fertilize an empty ovum, an ovum that has no characteristic of creating life. That is genetically. So if it is 46XX or 46XY, it is normal, you see. But it is an empty ovum, an egg of a woman that has no characteristics of producing life. You see, but the sperms are normal. They fertilize the egg, and then the egg has a problem. It starts to grow. You check it out. You know how a baby is how these things come. When the sperm fertilizes an ovum, they fuse and they start forming cells. That's where you get mesoderm, ectoderm, and endoderm. And when it is being induced to the uterus, it is called a blastocyst, layers of cells, and that is where life starts. But here in this the problem, when a sperm fertilizes an empty ovum, it will grow because it has some characteristics of. So the egg of a woman has characteristics of creating a life, but it is empty. The cells that are supposed to be there, some of them are not there. So it will start to grow, but it will bring something that is not a baby. You see, genetic material is almost entirely paternal in original. Then we have partial hydatid mole. Partial mole, that one was the first one. This one, you know that the egg of a woman, it is empty. It has some characteristics of producing a baby. Some, but the sperm is okay. You see, so when it fertilizes, you come up with an abnormal fetus or tissues may be present. Abnormal fetus like what? A head with one hand with organs that are not there. Only some villas are swollen, but some are attached. You may find some villas are swollen, but some are looking like this. You see, focal trophoblastic proliferation. This one has at least low hormone that we call HCG, low risk of malignant transformation. This one is the second one. The second one, it has low risk of malignant proliferation. But there is something that you may see. you may see that the complete hydatid mole, it has no fetus, it has no amniotic sac. But this second one has a fetus that is not a fetus. It has some characteristics of being a person. And you've had some things like, some women say, Chess K1, say hi. Chess K, hi. Welcome. Listen to this story as you subscribe and like. You have heard of some people saying, did you see what that woman gave birth to? That one is not a baby. That guy gave birth to an alien. Or that person gave birth to something that looks like a cow. And then superstition comes in, and then you start creating issues, funny stories. It is this molar pregnancy because the egg of the woman has a problem, and it is not producing the characteristics that are needed to be present so that a life can be normal. So this second one, you will see abnormal fetus or fetal tissues may be present. So even if it doesn't reach the delivery date and then you remove it out, you will see a fetus that is not a baby. A fetus that is not a baby. So if you are coming in and you are a new person, please tell us where you are watching from. Tell us where you are watching from and tell us how you're finding this topic of today. And if you have not subscribed, check on my friend, subscribe to the channel, subscribe, hit the like button. Usually triploid, you're supposed to have XX plus XY or XXX. This one you will get XXY, XXX, XYY. It is called triploid. We will learn about these things when I'll be telling people how to get a baby boy and how to get a baby girl. How God plans how you can get a baby boy and how God plans how you can get a baby girl. We will learn about that. Caused by fertilization of abnormal ovum by two sperms or by one sperm that duplicates it. So you see most of the problem that comes to hydatid mole, this molar pregnancy, the problem that mostly come is because of an empty ovum or an ovum. An ovum, I'm talking an egg of a woman that has no characteristics of bringing life normally. You see, and who can have these risk factors? There are some people that have risk factors of producing this molar pregnancy. Extreme maternal age, less than 20 years. Less than 20 years, you are not yet, And I've seen so many people getting pregnant at these ages. Yes, Burnout to be Blessed is here. Welcome, Burnout to be Blessed. Big up every time. Big up every time. I can see the votes are coming in. Votes are coming in. People believe that you can have positive pregnancy test and it's not a baby that you are carrying. Burnout to be Blessed. What's the view about that? Today we are talking about things that are complicated, and I'm trying to make them easier to understand. My work is to make things easy for people to understand. Welcome, Burnout to be Blessed. I can see you in the chat. So you are at risk when you are having less than 20 years and you want to conceive. Above 35 to 40 years, that is a problem. So it means if you want to get a baby between 25 years to 35 years, below 35 years. That is the span of 20 years. You will get a healthy baby with all the characteristics. Ben, yes, BD, how are you doing? How are you doing, big man? How are you feeling? How are you living? I'm cool, man. I'm cool. Today I'm just in my office feeling nice. And talking about this topic of pregnancy to our women and having beautiful baby boys and beautiful baby girls and understanding some complicated features that come out on pregnancy. Yes. Doing good. Yes, doing good. I can see you. Today we have Michael and Didi in the chat. Burnout to be Blessed. All of the people that are here. Big up every time and big you all. Rich is still here listening. Jamaican uncle always in the background as he is busy. Previous molar, if you have a previous molar pregnancy and then you try to get another baby, you must consult your doctor because maybe your eggs are coming out with a problem. So continuous trying to get a baby may end up getting several molar pregnancies. Nutritional deficiencies, especially vitamin A, carotene in some population. Vitamin A. Here to support. Thank you so much, Burnout to be Blessed. Thank you so much as I make people to understand this funny topic. You see, Asian ancestry, higher incidence in the region. Sometimes you may find a particular population has the problem. So here, the Asian population has had this problem so much. They have had this problem so much. And how does it come? This is how it comes. Abnormal fertilization. First, for you to start having a baby, there must be fertilization. The sperm swims and it feels good as it swims to go and meet the queen, the dear empress, the egg, the ovum, and they fuse. When they fuse, it creates another wall, and on that fused, it creates that egg now becomes bigger and creates a wall so that no other sperm can get in. Onic in the house, and then it produces some chemicals, so the other sperms die, so you cannot fertilize again. And then that ball itself, blastocyst, what does it do? It travels, it goes to the fallopian tube, and then it drops to the uterus, and then it implants. That is, from the day you make love and then the baby is formed, conception happens, that is like 4 to 6 days to the uterus. So implantation happens and we wait for a baby in 9 months. But now, here in this problem, we have an abnormal fertilization. And how are you doing? Onik, I'm fine. You have gone for so long. Hope you are doing good. Hope you are doing good. So, it is implanted, it is fertilized abnormally. The egg is empty. Excessive trophoblastic proliferation develops. Because now the egg of the woman is empty, the egg of the woman is empty. What happens? Abnormal things proliferate. They grow so fast and bigger. So faster. You see, even cancer cells, they grow so fast. So the egg is abnormal, so it grows so big and fast and produces many cells that are there. But it will just go, it will travel to the fallopian tube as it goes to be implanted, normally as a baby. Yeah? And when it reaches there, it will implant itself because there are cells that are fused, you see. And then the placenta grows bigger. It grows bigger and abnormal. The placenta grows big and abnormal because these are cells. It's not growing normally with the same time that is tuned as a baby. You know, the ovum had a problem. It was empty. It has no cell that produces life. You see, the uterus enlarges more rapidly than expected. That's why you have a lot of beta HCG hormone. You see how it happens. Krishna, I'm subscribed to you. Welcome, Krishna. Krishna is from India. Krishna, are you from India? Thanks for subscribing and coming to this channel. Here we talk about medical issues, Krishna. Hope you share and you ask us a question and you also tell us how you think about the topics we do and about the things we do here. I'm sure you will go through the videos and the things that we do. So, because now you have had, now you are pregnant, but what is growing is not a baby. Hydatid form mole. Fertilization is abnormal. The lady is producing empty eggs, but they are cells. When I mean empty eggs, I mean eggs that cannot produce life. Eggs that cannot produce life. They are producing another thing, but the sperm is normal. So, what are the features that will make you know, hey, my friend, you know I'm pregnant. I'm pregnant, but I'm not having a baby. What are the features that will make you feel like, no, this is a molar pregnancy? It is not the normal pregnancy. Vaginal bleeding are most common presentation. You are pregnant, but you are, you know, some people say a lady will come to a hospital and will tell you, doc, you know, I am pregnant and I am pregnant and I'm bleeding. I'm having menses. Someone told me that one day. I'm pregnant, but I'm having menses. So you look at the lady, you ask, how can you be pregnant and you're having menses? When you do the pregnancy test, it is positive. But you check, you do an ultrasound, you find out that this thing that is growing is not really a baby. So you start thinking, oh, it may be a growth, it may be fibroids, because fibroids grow so faster and make a person bleed. But the other thing is, you may even lose to have menses. Menses may not be there. Because now if you, something that is is growing mostly for the other one, not the first one. The first one we talked about complete hydatid mole. That one is no fetus and no amniotic sac. That one you may have symptoms of bleeding. But partial one, that one you may bleed. You may bleed so much. See? And sometimes you may just lack bleeding. You don't have menses. You see? Of course, when you are pregnant, you don't have menses. And why? Because your progesterone is high and you have something that is called corpus luteum, which takes care of pregnancy. So your uterus cannot come, the walls of your uterus cannot fly out. Yes, you are pregnant, so no menses. But when for few, you may find heavy bleeding, vaginal bleeding or partial bleeding, nausea. Sometimes you wake up. These are just signs of a pregnant woman. Lack of menses is a sign of a pregnant woman. I missed my period. What they say? You know what? I missed my period. That is a sign of pregnancy. If you are here and you are a guy and your girlfriend tells you, you know what? I missed my period. A sign of pregnant woman. And then you in the morning nauseated starts to, but the nausea that comes with this problem is very high, and you vomit a lot rather than the normal way that women feel nausea. It's normal to feel nausea when you are pregnant early in the morning in the first trimester, but this one you feel nausea and you vomit a lot, nausea and excessive bleeding, passage of grape-like vesicles. Let's come on now. Grape-like vesicles, because when that thing is growing inside you, the trophoblast, now it's a disease, it's not a baby. Some of them may be cutting themselves. You see how they grow, the violets grow, they are like grapes. So when you go to the loo, sometimes you see grape-like vesicles dropping, some things that are called like vesicles dropping up. Low abdominal pain or pelvic pressure, because now you are carrying something that is complicated and you are not carrying a baby. So what do you anticipate? There are several things that may happen. Pain, persistent pain, passage of things that are like, you see, clots, but these ones are grape-like, things like, you have seen grapes. Have you ever seen a grape, a fruit like a grape? They may be passing out. J Hank, greetings family, good to see you guys. Big up J Hank 47 out of Pick Up, massive. So the signs may be very funny. Uterus larger than expected. As the baby grows, you expect the first month it's like this, the second month it's this, the third month, you see. But here is the first month and the womb is there and you are bleeding. And when they go to do an ultrasound, they say you are having, this what you are carrying is not a baby. Although you are pregnant, but you are not carrying a baby. Imagine, Dr. Ben, greetings brother, good to see you. Thanks, J-Hack, thanks. Imagine if you have been trying to get a baby and this is your first baby, and then you end up getting trophoblastic disease, like gestational trophoblastic disease, like molar pregnancy. See, you need counseling, because this is a very bad situation. If you do a Doppler ultrasound, you cannot even hear the baby's heartbeat, because whatever that is growing is not a baby. They are just tissues there. The fetus has no movement. A growing tissue cannot have movement. Bilateral enlarged ovaries due to thicker leucine cyst. Ovaries are swollen like this. Ovaries, the ovaries. Let me draw the ovaries. You see, this is the flower itself. I call the uterus the flower itself. Flower itself. So the ovaries are here. Ovaries are here. If you're coming in right now, please tell us where you're watching from, and hit the like button and subscribe to the channel, because this is a very good place that we discuss very important points of life, like the one we are discussing is a very important. So this is a lady, This is a lady here. A lady. This is the uterus. So this one is the ovary. So in this disease, they are enlarged. You may find enlarged like this. You may find them enlarged like this. Instead of being like this, they are bigger. Why? Because they are pouches of fluids that fill fluids. The bear teacher, the bear like Dan, the bear teacher, welcome, thanks for tuning in. So they become bigger, and with assist is a water-filled vesicle. That's something that has fluid inside that is thick. So you may find those when you do an ultrasound, when you check the uterus of that woman, you find the ovaries are bigger, filled with some fluids. They are called theca lutein cyst. A cyst, anything in medicine, when you hear a cyst, what you need to understand is a cyst is a field, abnormal field with fluid, abnormally full fluid field. I'm Onyx's friend. Onyx is a great friend of mine. Yes, Onyx is a friend to everyone. Early onset preeclampsia before 20 weeks. Sometimes you start having high blood pressure. And when you check your urine, it shows you have proteins in urine. That one, if your test pregnancy is positive, you are positive in pregnancy in urine, and you have signs of high blood pressure with protein in urine, that we call preeclampsia. Features of hyperthyroidism, sometimes the sweating, anxious, bilateral enlarged ovaries due to theca lutein. Yes, I've seen you at Onyx. Oh, okay. So there are some things that we do to prove that this one is either mole. What do? We do a test that is an ultrasound. We do. As guys, you come in, there is a poll that is going on. Let's talk about it. Let's talk about what I've just given there. If you think it is true, please let's poll. So we do beta HCG levels. We do ultrasound. People say the picture itself. We check the ultrasound. We check inside the womb. You will see some things that are not a baby, and we treat. Treatment, definitive treatment. You cannot, as a woman, it is sad to say, you cannot keep something that is not growing as a lady, as a baby, sorry. So evacuation is there, but you may find that there are some people that are always getting these problems, and the only definitive treatment is hysterectomy. We remove the womb, because now, instead of having this problem every time, you remove. But if you find a woman is pregnant of this thing, what do? You remove earlier, so that it cannot bring problems. And which problems can this be brought with this kind of pregnancy? Heavy vaginal bleeding. You bleed heavily, and bleeding heavily, you use blood. Losing blood brings anemia. The other thing is hyperemesis gravidarum, nausea and vomiting. What does nausea and vomiting entail? You lose electrolytes, so the kidney suffers. You start having features of hyperthyroid. Preeclampsia less than 20 weeks, high blood pressure with proteins in urine. That one we call preeclampsia, less than 20 weeks. Ovarian theca lutein cysts. That one I've said, you find your ovaries are enlarged. Your ovaries are enlarged with fluids inside. You see, those are indications that you can get when you are in this situation. But in long term, you may find persistent gestational trophoblastic neoplasia. That is a form of tumor, which is a cancer. Invasive mole that goes up to the uterus and distracts. Choriocarcinoma and rare metastasis to the lungs. You see things how they grow and how things come. There are some things that are called persistent trophoblastic. Every time you get pregnant, this is what comes out. But the only thing you can do before the removal of that thing, so that you can end up to be normal, is to monitor vitals, assess whether you take vaginal bleeding. If the bleeding is too much, what do? You are going to be admitted and to follow the required protocol of evacuation of that thing that is not a baby. Give medications like antibiotics and drugs that will help you not to get anemia. You see, so we have talked about two things: complete mole and partial mole. They are totally different. One is not a baby, they are just muscles, things, tissues that are growing. The other one comes out with a baby, something that looks like a baby. And you have heard so many people mostly saying, that couple is cursed. They have brought out something that is like a lizard. You see, now you know how they come. They come like this because these ones are molar pregnancy. So you know some things right now, it's not being bewitched. You know they are medical and they are science. Let's talk about what may make this situation to come. What are the causes? Because someone may ask, I've seen a family that has these things. They are undergoing this. Every person who gets pregnant in their family gets to this situation. What is the problem here? What is the problem? The main cause of this problem is something that is called abnormal fertilization. Abnormal fertilization. The primary cause of molar pregnancy is abnormal fertilization. Normally, one egg of a woman is fertilized by one sperm. That is normal to get a normal baby. But, and let's talk about chromosomes. One egg has 23 chromosomes and one sperm has 23 chromosomes. When they fuse, that is 46. You know, the embryo develops with 46 chromosomes, 23 from the mother and 23 from the father. You see, you remember what I talked about, what is a chromosome. So let's learn about fertilization. Let's learn about fertilization and how. Where is my green? This one. So when people make love and the sperms flow to fertilize. So I want to draw a sperm and an ovum. So you remember we talked about the DNA and the chromosomes. Now I want to draw the DNA and the chromosomes. I want to draw the DNS and the chromosome so that someone may understand. Over and back. So look here. This is the sperm, this is the ovum. So these X things are the chromosomes. So it has 23, this one has 23. So when they fuse together, so this one has 23, this one has 23. When they fuse together, they produce 46. They produce 46. They produce how many? 46. When they fuse, they produce 40. This is normal. Then this one is called, it is the blastocyst that goes to start having a baby. This one, it starts having a baby. So you see, that is normal. That is normal fertilization. But now we have complete hydatid ball. Now I've talked about the normal. This is the normal. The sperm has fused with the ova of a woman. It has produced 46 chromosomes, which now will start having a normal baby. Now, empty egg. One sperm enters. The egg is empty. One sperm enters, duplicates its chromosome, results to 46 chromosomes, all from the father, usually 46XX. Imagine this being empty. This one comes with 23 and duplicates itself to come to 46. You get? So you get 46XX. Method 2, you get an empty egg. Is fertilized. Sperm fertilizes an empty egg, results to 46XY. Because as this sperm gets to the empty egg, it has to produce 46. You get? And then the outcome comes, you get no fetus developing. Because if this, let me draw it. Let me draw it so that people can see. You see, if this sperm fertilizes an empty egg, it will multiply itself to get to 46. But where are the characteristics of the ova, the woman's egg, which are needed to come out with a life? Where are those characteristics? They may not be there. There are no characteristics of the womb that needed to come out with. So it will produce something like a child, but it's not a child. We have said normally a woman should produce 46 chromosomes, 23 chromosomes, a man sperm 23 chromosomes to come out with 46 when they fuse, so that the baby comes out normal. But you see, this one gets, the egg is empty. It has no even chromosomes. So if the egg is empty, it has to produce its own 46. So it duplicates to 46, but where are the characteristics of the woman? The egg, the chromosomes. So you start having a baby, tissues that have no characteristics of life. You see? And these are the characteristics. No fetus developing, placenta tissues grows excessively. You know, for that normal growth of a baby to come, the placenta to be there, the veins to come out, to go to the liver. The 23 chromosomes of the woman have their own. They are like the cells. They have their own work. The 23 chromosomes that the sperm brings they have their own work, so that these things, when they fuse together, they start bringing life. They start producing life that grows with the science of life. But if one is empty, it lacks something. That emptiness, it lacks something that is growing out of this. You see, very important aspects in life. Very important aspects in life. You get now things are going funny. And which is the funny way that they are going? No placenta develops. Placenta tissues grows excessively. Chorionic villi becomes swollen and cystic. Chorionic villi becomes swollen and cystic. And very high beta CG, the hormone that is there, it becomes very high. Because now, you know, things that are making cells to grow faster, they produce so high levels of some chemicals and hormones. You see? Now, there is that one that is called partial hydatid mole. That is called partial hydatid. That was the first one, which is complete. That one, there is nothing like a baby. A normal egg is fertilized by 2 sperms. You find a normal egg is fertilized by 2 sperm. One sperm that duplicates itself. So you get 23 times 23 times what? Times 3. Now it is not even 46 so 2 sperms comes in. So you get how many chromosomes? You get 46 chromosomes. Imagine a normal egg being fertilized by 2 sperms, because 1 sperm, 23 chromosomes. 1 egg, 23 chromosomes. And then the other one comes with another 23 chromosomes. Another comes with 20. That one is 69. Triploid. Then there become confusion. Some placental tissues form. We have said this, listen to how it happens. The first one, which is complete hydatid, an empty egg is fertilized by a normal sperm which has 23. So the sperm duplicates itself. But here, the partial one, it's a normal egg fertilized by 2 sperms. So they have 69 chromosomes instead of 46 chromosomes. And then you start having placenta developing very abnormally. Yeah? And then because it is 69 and we require 46, the baby will start forming, but an abnormal baby, because now you have more chromosomes than needed. You see, an abnormal baby. You start having, you know, for you to get a normal baby, the egg of a woman has 23. The sperm has 23 chromosomes. That is 46. Then a baby is normal. But this one, which is partial, 2 sperms fertilize 1 egg. A normal egg. Now that is times 3. 23 times 3 is 69. A baby forms, but with several complications, with abnormal fetus, non-viable pregnancy. It's like the muscles or something grows like a baby. Less trophoblastic proliferation than complete mole. You see, I'm trying to explain the difference. Now, there is extreme maternal age, younger than less than 20 years, older than 34 to 40 years, especially over 40. So over 40 years getting a baby, a problem. Because the egg quality of a woman declines with age. Egg quality of a woman, you know, as you age, the quality of your eggs decline. increasing the likelihood of abnormal fertilization and chromosome errors. You see, genetics abnormalities, loss of maternal chromosomes, triploid, rare inherited defects, genes involved in embryonic development, rare inherited defects like like a woman having empty ovum, your eggs are empty, or chromosomes are less or are not there. The chromosomes are the ones which form the cells, and they come up with a child. So if you have no chromosomes, like your egg is empty, have no chromosome, it may be a genetic problem that is passed from your generation. You see. Now, there are some things that are lifestyle. There are some things that are lifestyle induced. And lifestyle induced things are like what? Vitamin A deficiency. If you are pregnant and you are having vitamin A deficiency, beta carotene. When you are pregnant, don't take a lot of meat, because they may bring retinol. Retinol is not good when you are pregnant. A lot of retinol, because it may interfere with the child, the cells at early pregnancy. The cells that are producing the child may be interfered with. So if you need carotene, you better take natural from plants. Ladies, you see. Folate, possible association. Women that don't like greens when they are pregnant. Women they don't like greens when they are pregnant. You like alcohol and you like meat. Imagine you are pregnant and you are taking alcohol and meat. What will happen? Alcohol stops some nutrients from being absorbed. Meat has retinol, destroying the trophoblast, the cells. And folate, you get it from leafy vegetables, green leafy vegetables. You like meat and you take a drink. So you don't have folate to help the DNA, and you are stopping some nutrients from being absorbed by taking alcohol. And the other thing is, you are taking meat, which has retinol, and it is destroying the child, the trophoblast that is forming the baby. So ladies that are pregnant, when you get that you are pregnant, what you do is you desist from taking a lot of alcohol. Don't take alcohol, and don't eat a lot of meat. Avoid high retinol levels. Avoid high retinol levels. Vitamin A helps maintain healthy trophoblastic tissues. So deficiency may contribute to abnormal placental development. Vitamin A, very important. Vitamin A, very important, my dear friends. So previous miscarriages is another thing. Women with recurrent miscarriage may have slightly increased risk of molar pregnancy, although most miscarriages are not caused by molar disease. ARTs, assistant reproductive technologies, like IVF, in vivo fertilization, and then implanted in your uterus, is another problem. Ethnicity and geographical factors, where you stay, where you live. Asian countries, Japan, Indonesia, and Philippines have been related to these problems a lot. Family histories. There are families that have this problem. Rare inherited forms of recurrent molar pregnancies in family are associated with mutations in genes, such as there is a gene that is called NLRP7 and KHDC3L. They are uncommon, but they are there. People have them in their and their families. You see? So there are some features that you should suspect when you have these problems. Features that you can suspect when you have these problems. What are the features? Vaginal bleeding, excessive nausea and vomiting. You are bleeding in pregnancy and you are having excessive nausea and vomiting. Uterus larger than expected. The uterus is large than expected. And when the uterus is large, you expect to have a baby inside and you expect to have a fetal heart sound. But when you are going to do that Doppler ultrasound, there is no heart sound, no fetal heart sound. A heart sound is heard. And then when you do an ultrasound, you see a white thing. We call it a snow storm. A white thing instead of seeing a baby appearance. When you take the hormone that we do to check, you see very high beta HCG levels. Very high beta HCG levels in your urine, in your blood. And then if you are having this thing, the other thing is you will have something that is called high blood pressure. Below 20 weeks, imagine the first trimester, 3 months, you are a lady carrying something that is like a pregnancy. Your womb is so big, pressures are so high. When you take your urine, you see there are proteins in urine. That is called preeclampsia. You have to start suspecting something is not right here. Something is not right. Why am I told that I'm having something that looks like a baby and it's not a baby? You see? Things someone should suspect when you're having molar pregnancy. And signs of hyperthyroidism. You start having palpitations, tremors, weight loss, because the beta HCG hormone is very high. It is interfering with your thyroid gland. And then we have said the other thing, when you do an ultrasound, you find water-filled ovaries. You see that? Very complicated, yes? Those are the signs that you should look and see, no, there is a problem. And when you find that when you find that you are having a very complicated and I don't want to say complicated, but nausea episodes and vomiting a lot, you should think twice. Someone asked me, and I'm always being asked, when should I start going to the ANC? Start immediately you find out that you are pregnant. Immediately you find out that you are pregnant, you start going to ANC. You see, it's very important. So those are signs that you are having or you are carrying a hydatid molar pregnancy. So you, as you are having these problems of molar pregnancies are not good things. They are complicated masses in your body. Molar pregnancies are not good things. One, a woman wants her baby and this woman is carrying a molar pregnancy. It affects you mentally. You start having mental issues. Second, you start having complications of what? Leading to anemia. Bleedings that lead to anemia are not good things. they are injuring your. But the most important part is when it comes to mental health, because now you think you are carrying a baby and you have a positive blood test on pregnancy, and when you're having a positive blood test on pregnancy, people congratulate you. Everyone is waiting for first time mothers. You are married and then you want to have a baby, you want to someone to be laughing around the house making noise, and now it is not having a baby, it is having something else. What do you think? Mental health, you see. So it is important to always, when you are feeling nauseated, and as you have seen, women that have molar pregnancy, most of their wombs, and they are bigger than gestation. So when people tell you that you are having a bigger womb, this baby will be big and you are bleeding in pregnancy, just know you are having gestational trophoblastic disease. But there are two ways we have seen. If you have it, or you have seen a person who has it, and the evacuated fetus was like a fetus, just know the woman was okay. But the problem is the woman was fertilized with 2 sperms, and it brought something that is called triploid. That we came to partial trophoblastic disease. But when you find that there is no baby, no heart sound, it means the woman was the problem. It produced something that is called complete trophoblastic disease. And it's important sometimes to understand these things. Although they are complicated, people say that medical issues are complicated. They are not complicated. The only factor that you need to understand is things that come out and what causes. What we have gone through is what causes the problems. But now, you have seen there are several things that make people get molar pregnancies. And the specific things that make people get molar pregnancies, the most specific things that make people get molar pregnancy is lifestyle, nutritional care, issues away from genetics, alcohol intake. You like taking things like meat and alcohol, drugs, abusing drugs in pregnancy. You may smoking in pregnancy. You may end up having this problem that we are saying. You see, yes? Iko sawa, mrelease tu, mwambie niko online na class. Mwambie kesho akuje, kesho arudi apime.
Okay, sawa. Kama
jioni kama saa. Yes. So you see, these are things that you need to understand and you need to check out and evaluate. Because I've seen some people in the villages, and not even in the villages, saying, I've met some families that say, you can do nothing about that because that family is bewitched. They bring out children that are having these problems. This person was bewitched to come out with a trophoblastic disease. No, it cannot be that way. When you are anticipating to get a child and you have been drinking alcohol, stop it. Stop the drugs. If it is genetic, if you have a relative that had that and you are having it, before you get to having a baby, go to your doctor. Tell your doctor that my relative had this or my mom had this. How can I help myself to avoid to get another problem like this one? You check. You will be advised according to the outcomes of your previous relatives, like if it is partial or complete. If it is partial or complete, you see, it is very important for you to be following up on these matters when it is needed. So that is molar pregnancy, my friends, for what we have talked about, and it is deep. It's just I've gone not. If I go deep, it will be so complicated. But that one I'll post it when it comes to educational matters, where now I have students. Students you need to go deep because of exams. So that is it, my fellow guys. If you have been here, you have been following, and from the beginning, thank you so much for you being here. We try and do things in the right way, and sensitize the people. The only thing that I do is sensitization. Sensitization is very important when it comes to people knowing. So molar pregnancy is all about fertilization in the wrong way and then ending up with a thing that is not a child. So if you are here and wait a minute, if you are here and you have a question, it's your time to ask that question. It's your time to ask that question so that I can do what? I can explain it to you. It has been a good day, and the molar pregnancy was the talk of the day. The talk of the day was molar pregnancy. I can see we have 7 votes saying, everyone is saying yes, which means it can happen, and let me check on this. Other questions that are there in the background, let me check on other questions that are here in the background. I read some of them. And if you are watching and you have a question, if you are here and you're having a question for today from 4 p.m. to 5 p.m. UK time, what time will that be? I'm being invited on a meeting on the UK time. Let me see. What time will it be in Kenya? So that is it, my friends. I know you are watching, some of you. Oh, the meeting has already started. Let me get in. Okay, now that is it, my friends, and thank you so much on participating. And I think I'll end this because you see I'm being invited in another meeting which is important. I'm being invited in a meeting which is important. Let me get into it. I hear and see what is going on there. So probably tomorrow we'll talk about another topic. Be blessed, everyone, and have another time. Be blessed. Bye bye. Till tomorrow.